So, to get started, thank you so much for attending today on a Saturday. We were discussing that earlier, how we know it's Saturday, it's 1 o'clock. At least it's a bit gloomy outside. And so, as mentioned, my name is Caitlin, and I'm a social worker at London Health Science Center. My role covers multiple departments at the hospital, including the Bleeding Disorders Clinic. I am still learning about hemophilia and what that means to have a bleeding disorder. But as Natalie mentioned, I do have a range of experience in mental health. And before I get started, I do want to be mindful and transparent that some of the topics I discuss today may cause some discomfort. For instance, on the next slide, I do discuss my past work experience around suicide prevention and other mental health related topics. I am always open to feedback and suggestions, and I will provide my contact information at the end of this presentation. So please don't hesitate to reach out if you have any questions or feedback. So Natalie gave a lovely intro, so thank you for that, Natalie. So this might be just a tiny bit repetitive, so I apologize, but this is about myself to start building that rapport. So I did get my psychology degree at the University of Western Ontario. I completed my Master's of Social Work at the University of Windsor. And while I was completing my master's degree, I worked with a team to implement the Zero Suicide Initiative at a local mental health hospital. This initiative really focused on making sure all patients were screened for suicidality to make sure that no one fell through the gaps in their healthcare journey. And this definitely has guided my practice as a social worker as I encourage topics around safety planning and suicide prevention. Following this lovely work experience, I then started my social work career as a therapist for first responders. I practiced through a couple lenses, so cognitive processing therapy and cognitive behavioral therapy. I also provided psychoeducation in this role. And then now, as mentioned, I'm a social worker in several medicine departments at LHSC, including bleeding disorders and cystic fibrosis. So today we're going to talk about psychoeducation, which is typically the sharing of mental health concepts, topics, and evidence-based treatment approaches. So here are the topics that we'll discuss today. It was kind of tricky picking the topics as there's so much in this field to talk about. So I narrowed it down to these: anxiety, cognitive distortions, CBT, so cognitive behavioral therapy, behavioral activation, emotion regulation, and then at the end, hopefully we have some time for a discussion or if there are any questions. So to start at the large topic of anxiety, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes. There is a difference between anxiety and fear, but people often use these terms interchangeably. So anxiety is considered future-oriented, and it's often a response to an unknown threat, a perceived threat, or maybe even an internal struggle, such as a thought, while fear is often present-oriented and focused on a known external danger. So it is also important to acknowledge that mild short-term anxiety can be beneficial, as it is our body's normal response to a potential stressor. So for instance, research shows that anxiety can improve performance, sorry. So for example, I can relate to this when I was doing my master's or studying in my undergrad. Weeks before the exam, it was sometimes hard to focus on studying. I sometimes lacked maybe a little bit of motivation to study, but then the day before or the night before, I could really hunker down and focus on the material. Research really shows this in multiple studies regarding anxiety and performance, as long as you don't experience too much anxiety, as that can affect your ability to focus. Another interesting perspective is that anxiety can increase or positively affect empathy. So you start to be able to understand others' personal challenges and be able to put yourself in someone else's shoes. So anxiety and bleeding disorders. So as we probably know, chronic diseases can affect symptoms of anxiety. And when emotional concerns linger, anxiety can result. This in turn can serve as a severe domino effect. So for instance, if you're experiencing depression and it's untreated, then you may be less likely to do infusions or go to clinic appointments. And furthermore, a lot of studies show that anxiety can worsen pain perception in people with hemophilia. Therefore, it is so incredibly important to talk about mental health during your appointments. And a way that I do this as a clinician is I have started screening patients for depression and anxiety with the PHQ-9 and GAD-7, which are evidence-based screening tools. And then I can use those results to monitor symptoms of mental health and provide appropriate treatment options. So when does it become a concern? In general, for a person to be diagnosed with an anxiety disorder, the anxiety must be out of proportion to the situation or be age inappropriate and hinder the ability to function normally. So in other words, a person should seek assistance if they experience excessive anxiety, which is difficult to control. They start developing unhealthy coping mechanisms, such as substance misuse. And then they find those symptoms start to interfere with daily activities or relationships. And here are some different types of anxiety disorders. So GAD, or generalized anxiety disorder, phobias, social anxiety, or panic disorder, where you start experiencing a lot of those physical episodes, such as panic attacks. And then there are anxiety-related conditions, such as PTSD, adjustment disorder, acute stress disorder, or OCD, obsessive compulsive disorder. And this is not an exhaustive list by any means. And then some Canadian statistics. According to the Canadian Mental Health Association, about 1 in 5 people in Canada in any given year personally experience a mental health concern. And then by the age 40, so about 50% of the population in Canada will have a mental illness or had one. So this is a key concept of avoidance and anxiety, where avoidance can occur and negatively affect anxiety symptoms. So for example, if let's say you ate something and then the next day you started experiencing flu-like symptoms, you might then associate that sickness to that food you ate and then avoid eating that food ever again, even though maybe you really enjoyed that meal or maybe it actually had no risk in eating it. This is a key example of avoidance. Avoidance does help protect us, but it is a concern if you use avoidance when there actually is not a danger. So the picture on the bottom left demonstrates this and the effects of avoidance. And we can actually use this to relate to even OCD, obsessive compulsive disorder. So people with OCD often participate in rituals to avoid those feelings of anxiety or even to try and reduce those anxious feelings. So an example of a ritual could be, let's say, you often triple check that the front door is locked. And so let's say you already double checked and you're about to carry on with your day, but then you start experiencing some anxiety. You don't want to feel this. You want to just carry on. So you're like, okay, I will just triple check that the door is locked. You then feel some short-term relief, but ultimately anxiety is reinforced, including that ritual. If instead you acknowledge those feelings of anxiety, let them come, let them go, you are spending time processing that anxiety, and ultimately, long term, you'll experience lower levels of stress, be more mindful or present, and improve emotion regulation. Now to review cognitive distortions. There's other words for this term, such as intrusive thoughts, automatic negative thoughts, unhelpful thinking, etc. These can loop repeatedly in our minds quickly and effortlessly. They are often exaggerated, biased, distorted, or unrealistic. And they might even occur as you're trying to gain insight of a situation or even try to arrive at a solution. There are several different types of cognitive distortions. And a thing that I often remind clients is just because you have a thought does not mean it is true. And same with anxiety, allow those thoughts to come and go. They don't control you, and it does not mean that they are necessarily accurate or true. And sometimes it involves spending some time even challenging them or evaluating the evidence for and against them. So here are some examples of cognitive distortions. I would love to review all of them, but due to time, I thought I would just pick 3 of them. There was no particular reason for my choice of the 3 that I'm going to review. So the first one is discounting the positive. So dismissing something that is genuinely good. You might reason that it was just luck or the person did not mean it. You might often say, yes, but, and this can also relate to imposter syndrome even, where you're discounting your success. So here, let's say a stranger compliments your outfit. If you participate in this distortion of discounting the positive, some automatic thoughts could be, oh, they're just being nice, or that's nice, but they probably just feel bad for me. This in turn can create even some more anxiety. Another example is catastrophizing. So here for this distortion, you often think of worst case scenarios. So here's an example. Let's say you studied really hard the day before, as I mentioned, related to hunkering down, being able to focus and concentrate and try to grasp all the material, but you still failed the exam. Some catastrophizing related distortions or thoughts could be, I will never graduate. I am never going to get a job. I'm going to be a total failure. And you can already see how that is going to start piquing your anxiety a bit and even mental health related symptoms. Another third example, the last example to review for today, is emotional reasoning. So here, this is basing your thoughts on the feelings that you're currently experiencing. So let's say you are in a long-term relationship that you would classify as healthy. You gain a lot of happiness in that relationship, but sometimes you have feelings of jealousy. So some distortions that you could experience if you participate in emotional reasoning could be, I can't trust them, or they are cheating on me, this relationship will never work. And again, you're basing those thoughts just on those feelings of jealousy. This could also even be catastrophic thinking. as it relates to the example before. So here it is so important to challenge those thoughts, to acknowledge them and spend some time evaluating the evidence for and against those thoughts and determining, are they truly accurate? As you can see, our minds are always interpreting the world around us, even in this presentation. We're trying to make sense of things, but sometimes we do see things inaccurately, or we have our own biases that we carry with us. This approach of cognitive behavioral therapy, I will refer to it as CBT from now on, as it is quite a long name. This is an evidence-based approach which can effectively treat a range of mental health concerns, including depression or anxiety. They do practice from three core principles, and they are psychological problems are based, going too fast, there we go. Psychological problems are based in part on faulty or unhelpful ways of thinking. So again, those cognitive distortions that we just reviewed. Problems are based in part on learned patterns of unhelpful behavior, and people suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms. So again, these are CBT's core principles. Here is a picture of often what people think drives our emotions. So again, you experience some intense emotion or negative emotion, and you instantly think it was brought forward due to a situation or specific event. But often we have those thoughts that are brought up from that event that then in turn affect our emotions. And this is a technique that is used often in CBT. It's the ABC model. So again, looking at the connection between those three pieces. So, and even externalizing your thoughts by writing it down can be quite effective. So first you write down that event that happened, your thoughts, and then the consequences, meaning the emotions that you experience or even those behaviors. So here is an example. So my partner comes home from work, does not eat dinner that I made, and goes to bed early without doing chores. Here are some automatic thoughts that maybe are unhelpful or maybe even a bit distorted. He does not appreciate the work I do around the house. He is lazy. He does not like my cooking. And then as a consequence, the emotions that I then experience could include anger, frustration, discouragement, maybe even a bit of resentment. And then behaviors could include, you know what, tomorrow morning when he wakes up, I'm gonna start a conversation that leads into an argument, as I feel like there is a lack of effort displayed. You can see how writing this down, really, you can start seeing the pieces of how they are all connected. The next step to this is then, so it's called ABCDEF model, where you start disputing your thoughts and emotions and start challenging them a bit, looking at the evidence for and against those thoughts. So disputation to what I just shared could be, wait, did he say he does not appreciate me? Did he actually say that? Did he ever say he doesn't like my cooking? I'm pretty sure he often says he enjoys the meal. Do I ever go to bed early and not do my chores? And would I find it very fair if he then instantly assumed that I'm lazy? And so then again, you're challenging those thoughts, and then you arrive at an alternative, more effective thought. So maybe he had a busy day at work. Maybe he does not feel well. I guess I never asked him those questions. I guess I haven't asked him in a while how his work has been going. So I will ask him tomorrow morning how work has been lately. As a result, you then arrive to more neutral or even positive in a way feelings such as curiosity, maybe a bit concerned, and then some calmness. This is just another example of recording your thoughts, externalizing your thoughts. Even verbally saying your thoughts out loud can be effective. The key point in this thought record is that middle column. Again, you're evaluating the evidence for and against that thought and effectively challenging it. And if you do find that, you know what, maybe it wasn't the most helpful thought, then arriving at that alternative thought. You can access thought records online. A lot of them are free to access. You can even just start journaling your thoughts if you're ever experiencing some stressful thoughts. Journaling can also be effective, and there's even a lot of journaling prompts that you can find online. The next topic for today is behavioral activation. This can be effective in decreasing depression, anxiety. This approach uses behaviors to affect emotions. So people often believe that we get motivation and then we'll start participating in an activity, but often it's the opposite case. So for example, the gym. People might say, oh, I haven't been to the gym in a while, but I just don't feel motivated. I've been guilty of that. And in turn, it's once you start going to the gym, you might then start experiencing some motivation. As a lot of people say, you'll never regret a workout. And then you're more likely to return again to the gym. So this approach is focused on practicing certain positive behaviors to activate a positive emotional state. But unfortunately, according to this theory, the opposite is also true. So inactivity may then increase depression. So here it shows the importance of noticing how your behaviors affect your emotions. So in focusing too on activities that bring fulfillment and enjoyment. And by minimizing or replacing unhelpful behaviors, your mood will hopefully then improve. And that's the same with cognitive distortions, hopefully replacing unhelpful thoughts with more helpful, more accurate thoughts, then the idea is that then your mood will improve. Here is a general example of how you can start initiating some behavioral activation through an activity menu. Again, online, they have so many different menus that show different activities. It just really helps start brainstorming. You can cross off any that you're like, heck no, I'm not going to Michael's craft store to look for craft supplies. But then you might circle some that you haven't tried before. And it just, again, it encourages to think outside the box. Another way for behavioral activation to start is through habit tracking. So this left column shows some habits that maybe you want to initiate. And then those boxes of the numbers show the days of the month. This is quite a pretty example of this habit tracking. It doesn't have to be this neat and pretty, but really the idea is highlighting those days that you did participate in the habit. And then this way you can monitor and track your progress and maybe even see areas of improvement. So for example, with that reading activity that's shown, looks like they really excelled at the beginning. And so then it shows, you know what happened there? I stopped participating near the end. Oh, maybe that's an area that I would like to work on. And I'm sorry if you hear my dog barking. Now the next one is emotion regulation. And this is one of the last topics for today. So this is the ability to effectively manage and respond to an emotional experience. And we often use strategies to cope with emotions, often unconsciously. We might not even be aware of the strategies that we are using and if they're helpful or unhelpful. Here are some examples of emotion regulation strategies. I use the terms healthy versus unhealthy quite broadly. Some healthy ones, potentially healthy ones, could be talking with a friend, a loved one, exercising, so that behavioral activation piece we talked about, self-care, externalizing those thoughts, which also relates to monitoring your cognitive distortions. And then some unhealthy strategies could be that avoidance piece, which we reviewed already, maybe some aggression, so that maybe anger in the form of verbal outbursts, isolation, or substance misuse. And here are some examples of emotional dysregulation. So the first one, you have a disagreement with your partner and assume that they will never understand you, and you react with intense anger, yelling, and walking away. Another one could be your child is playing by themselves but is making a lot of noise. You feel overstimulated, overwhelmed, frustrated, so then you yell at your child to go to their room. A way to combat this emotional dysregulation is through the use of tip skills. And there's 4 main ones. You don't have to use all 4 at once. You can find which one works best for you. There's also different ways to use each one. So we'll review these 4. I'll share some ways to use them, some examples, and then I'll provide a summary for the presentation. So the first one being temperature. Here you're using temperature to activate the mammalian dive reflex in the vagus nerve. That sounds quite complex, but there is so much research backing this up. It's quite an interesting area of research. So using temperature can be an instant short-term relief from anxiety, and it's really focused on the physiological response to water. So to briefly explain, the diver's reflex is a series of physiological changes that occur when a mammal is underwater, holding their breath, or when the face is cooled. And it occurs to preserve life. In response to this, your heart rate decreases, your breathing decreases. So when using cold water on your face, the vagus nerve is activated, which is the longest nerve in the body. So this nerve plays a large role in the autonomic nervous system as it connects your brain to important organs. So therefore, the vagus nerve plays a key role in your parasympathetic nervous system, as it can influence breathing, digestion, and heart rate. So to instantly activate a more relaxed state, in other words, lower your heart rate, you might want to activate your vagus nerve by even using an ice pack on your face. I sometimes encourage around the forehead. I even recently saw, might have even been on TikTok, that I saw that someone used a jade roller. They put the roller in the freezer, and then whenever they're feeling a bit anxious or overwhelmed, they take it out and they just start rolling their face with that. You can also, as the picture shows, dip your face in cold water. Or even, I often recommend this with clients when showering during the last 30 seconds. You can always work your way up. So maybe the last 10 seconds, change the water to very cold. It's not fun, but it will put you in a more restful state, and it will quickly reduce your anxiety, at least for the short term. The next one is intense exercise. I don't love the word intense for this, so we can look at it as cardio. This is about spending conserved energy to reduce overwhelming emotions. And it really relates to behavioral activation, so we won't spend too much time on this one. But really, 10 to 15 minutes of exercise, you don't have to overdo it when you're experiencing overwhelming emotions. So for instance, even going for a fast walk around the block for 10 minutes can hopefully reduce some anxiety. Third one is paced breathing. So this technique involves slowing your breathing and gaining control of your breath. There are a couple examples of how to do this, but a somewhat easier one to follow is box breathing. And so this picture on the right hand at the bottom corner shows this. So you breathe in for 4. Sorry, my phone's going off. You breathe in for 4, and then you hold for 4 seconds. And then you breathe out for 4, and then you hold for 4 seconds. And then the last one to review is progressive muscle relaxation, or PMR. This involves tensing specific muscle groups and then releasing the tension. So for example, there's the picture on the right-hand side. It is encouraged to sit in a chair when you do this. You may even close your eyes. And then you're also focusing on breathing during this. This one, I definitely encourage YouTubing the videos as guidance. There are so many on there. Use that as your resource, your free resource. And then you can even establish a routine with this if you find it to be beneficial. So here is the summary. We reviewed quite a few coping strategies, including the ABC model, thought record, activity menu, habit tracker, and tip skills. There are so many different other strategies that you can use, so please keep that in mind. And sorry, now of course I have a tickle in my throat. And then here are some Ontario mental health support resources. There's also a resource on psychologytoday.com where I often encourage to look at this. It's therapists in your community that are available for services. Thank you so much for listening. Thank goodness this is almost done as my throat is still tickling. I really appreciate your time. And again, if you have any feedback at all, please don't hesitate to reach out. And if you have any questions, please let me know.